Good afternoon. My name is Jim Capretta. I am a senior fellow here at the American Enterprise Institute. I am pleased to welcome you to today's virtual event on budgeting for 2050, thinking strategically about tax and fiscal policy for a stronger America. My guest is Dr. Eugene Steuerle, the Richard B. Fisher Chair at the Urban Institute. Gene, who I've known a long time and consider a terrific professional colleague, is one of the country's most respected tax and fiscal policy scholars. Our topic is a familiar one, the country's mounting fiscal challenges, but we were looking at it from perhaps a slightly different perspective than it normally is the case. Instead of focusing on near-term debt growth or balancing the budget in some near-term time frame, the question we would like to address, or at least I would like to address, this is Gene, who's a real expert on this topic, is what should the U.S. do now to change the trajectory of spending and taxes over a longer period of time in a way that will be beneficial for the country now, also today, but also really in the future for future generations of workers and retirees. After I introduce Dr. Steuerle, he will make some introductory comments, and then he and I will engage in a discussion based on a series of questions that I have. With about 5 minutes left before we adjourn, which will be promptly at 12:45, I will turn to a small number of audience questions if we receive any. So if you are watching this event today live and you'd like to submit a question, please send it by email to jack.rowing@aei.org. That is jack.rowing, R-O-W-I-G, at aei.org. His address is also, email address can also be found on today's webpage. Alternatively, you can send a question to Jack via the social networking app X by using the hashtag AskAEIEcon. Now to our guest. Eugene Steuerle is an Institute Fellow and the Richard B. Fisher Chair at the Urban Institute. He's also affiliated with the Tax Policy Center, which is run by the Urban Brookings Institutions. Among his past positions was as Deputy Assistant Secretary of the U.S. Department of the Treasury for Tax Analysis, President of the National Tax Association, Coordinator of the Urban Institute Tax Policy Center, Chair of the 1999 Technical Panel Advising Social Security, and Chair of the 2015-2016 National Academy of Sciences Committee on Advancing the Power of Economic Evidence to Inform Investments in Children, Youth, and Families. Between 1984 and 1986, he was the economic coordinator and original organizer of the Treasury's tax reform effort, which led to perhaps the most significant tax reform bill enacted in the last half century. He is the author, co-author, and co-editor of 18 books, if you can believe that, most recently including Dead Men Ruling, Nonprofits and Government, Contemporary U.S. Tax Policy, second edition, and Advancing the Power of Economic Evidence to Inform Investments in Children, Youth, and Families. He's a founder and chair emeritus of ACT for Alexandria, a community foundation. He's been on advisory boards for many organizations, including CBO and others. He received the Bruce Davey Albert Davis Public Service Award from the National Tax Association in 2005, and distinguished or outstanding alumnus from University of Dayton, and also his high school, I believe. Finally, he earned his PhD in economics from the University of Wisconsin. So I know that was a lot, but you've had a long and distinguished career. So thank you for coming today, taking the time. Please proceed. Oh, before we get going, I also want to mention that Gene is associated with a blog called Government We Deserve, which you can find on Substack, which is an excellent way of following his work on a more continuous basis. So please go to Government We Deserve at the Substack distribution system. Gene, go ahead.
Well, thank you for that long introduction,
yes.
Jim. I think it gets longer the older I get. I'm not sure. I'm not sure qualitatively the difference. But anyway, I'm going to cut to the chase here. So you're asking, how can we think about and solve our long-term problems. And it's really not much different today than it's ever been in the past. And to cut to the chase, basically, as long as we have an economy that's growing, and we have, even though at more modest rates today, or more modest rates than we might think are necessary, you could take that economic growth and start orienting it towards your new needs. You could orient to what the public wants, the way they're voting. Well, you and I might not agree with it, but that's the nature of a democracy. That's how you solve the problem. And what we're going to discuss today is also giving a bit of a long-term view of the past. So the title of my talk was Zombie Rule, which is also the title of a book that I hope to get out on Amazon within a month or so. And what do I mean by zombie rule? It relates to a previous book. In fact, it's a takeoff on a previous book on dead man ruling. It's basically that legislators in the past are almost totally controlling the direction of policy. And that makes it very hard, not just for us to do new things, but politically to allow legislators to say, okay, let's stop meeting all these promises we made in the past and do what else we want. Now, that's whether you have a bigger government or smaller government, it doesn't matter. So much is promised now that we just locked everybody in. So the zombies, the dead, and they are men, the men from the past, mainly men, are basically ruling over us. So to proceed, there's actually three terms I have to cover very quickly because I'm going to use them, but I just want to clarify them. I'm going to talk about the giveaway and the takeaway side of the budget. The giveaway side are things like tax cuts and spending increases, things we like and that the presidential campaign, presidential and congressional campaigners all tell us that they'll give us. The takeaway side is how you pay for everything, and everything has to be paid for. It doesn't mean it's not good to do them, you still pay for them. The takeaway side is a tax increase or a spending cut. So that's one terminological thing. The second one is one you're quite familiar with, but perhaps not everybody in the audience, is we have in the budget what are called mandatory spending versus discretionary. And to simplify it, mandatory spending is stuff that's already built into law and just continues until Congress basically stops it. Discretionary spending is what Congress does every year, mainly in appropriations, to say, okay, here's what we're going to do this year, and now next year we're going to debate it again. As you might guess, this mandatory spending is going to play a big role in this control of the future. And the third one you've already covered, which is the long term versus the short term, but I also want people to think about that in terms of the budget. The short term budget problem is you have a Congress that is profligate year after year after year, and you've got to do something to get things back into balance. That's been the story throughout most of our history. The long-term budget has only had a problem in recent years when we put so much in the tax code and the spending codes that foreordain how spending is going to be 10, 20, even an infinite number of years in the future. We didn't have that. So the long-term budget problem is a new one. The short-term one we always have, but the long-term one is a new one. So with that somewhat technical discussion, let me go quickly to my slides here. And I just have three of them very quickly. Yeah. Sorry. So the first one, this is basically the type of budget we had year after year. Now, what are these lines? The lines are what would happen if a Congressional Budget Office in the past had projected the direction of revenues and the direction of spending into the future. Well, most spending was discretionary. It didn't continue automatically. The post office was built. You didn't necessarily have to build another one, new one, but you still might have to put some staff in there. So it wasn't spending dropped to zero, but projected in the future, a budget office would say real spending was going to decline because it wasn't foreordained. It's particularly true in wartime. The war ends, the spending stops. Revenues were growing because the economy is growing. So if you look at that line and the gap between revenues and spending, and you look out into the long term, there's a surplus growing continually into the future. You might, if you look on the left-hand side, you might have deficits now, but the long-term budget would have always been in balance. Now let's move to the next slide here. This is the type of budget we have now. Today, spending grows faster than revenues. It grows faster than the economy. That's automatically growing, even if Congress never does anything. So now the issue is you've got a long-term budget problem on top of a short-term one of Congress being profligate year after year. And that's the box, basically the box we're in. It's very simple to explain. Politically, it creates a problem. And I'll go quickly to the last slide here because I want to get to your questions and answers. This is a measure that I've come up with, which I call a measure of fiscal democracy, because I think it does affect democracy. This is the share of revenues left, or the share of receipts left, after you take into account the spending that's already foreordained, it's already in the law. That includes the revenues. How much of revenues are left after you take into account all that automatic spending? Well, if you notice, it was never negative in the past. In the 60s, it was usually about 60% of receipts had not been committed. Now, you still probably would have committed them to continue the highways or whatever, but they weren't permanently committed. Today, as you look out onto the right-hand side, every dollar of receipts is committed before each Congress walks in the door. So now what type of a problem does that create? Well, it creates a huge political problem because now the job of Congress is to renege on some past promise. It's both for spending growth, which in some programs is faster than GDP, so it's impossible to maintain, or it's to renege by saying, well, maybe we do have to collect enough taxes to pay for what we're doing. And that dilemma of having to renege on past promises, which is the only way you get out of this box, is a huge political dilemma. But let me just conclude by, again, where I started. It's not an economic dilemma. There's a lot to do in the future. The question is, do we want zombies or dead men or dead women now? There's more women finally in Congress. Do we want them mandating the future, or do we want to have some decision-making ourselves?
Very good. Well, let's dive in a little bit more on some of the mechanics of the predetermined spending line. We'll talk about taxes in a minute too, but on the spending line, you've done a very large amount of work looking at Social Security especially, but also Medicare. Those are, of course, the most sensitive programs because they affect the retiree population. There are other programs with predetermined amounts of spending going forward. But let's separate out a lot of the confusion and focus in on those two big ones, because that is really, my judgment, a lot of the heart of the problem. How to think about Social Security and Medicare.
I would add all health programs.
All health programs.
But Medicare's the dominant.
Medicare's the dominant. Talk about Social Security for a minute. People say, well, are they talking about cutting Social Security? Explain a little bit more about how this real growth is built directly into how Social Security operates beyond its level of payroll tax collections, frankly. I mean, even that's one main reason why Social Security is projected to go insolvent, is that there's real growth beyond the tax revenue expected. So the trust fund goes insolvent, that's built into the baseline. We still assume we're going to spend the money, even though the trust fund is supposed to be an accounting device to check that extra spending. How should we be thinking about that, and maybe how does a politician start to think about it and convey to the public what's really going on here?
Well, it's interesting, again, going back a little bit into history, and you know this history well. If you go back into the 40s, 50s, and 60s, Social Security was small. And basically, the Democrats and the Republicans competed with each other as to who could, I'd say an almost discretionary basis, decide how benefits would grow for future retirees. Now, for existing retirees, let's be clear, almost always, we've pretty much maintained their benefit, in most cases, at least their real benefit, sometimes even more than that. Along about the 70s, Congress decided, well, we keep going back and forth and fighting, let's make this automatic. And so they built in certain provisions, these are technical, they built in a couple things. The biggest one was something called wage indexing. They decided that if my children were going to be making 50% more than I am, or 20% more, then their annual benefit needed to be 50% or 20% bigger than mine. And we're just going to build that into the law, regardless of whether we have another war, we have some other priority, we have a COVID crisis, it doesn't matter. We're automatically going to increase their benefits along with wages in the economy. What that means essentially by itself is that those benefits would grow as fast as the economy, crudely speaking, because wages would typically grow with the per capita wages would grow with the economy. Then, added to that, in Social Security, they've never really adjusted, except for one minor adjustment, for the fact we live longer. So now a typical couple gets benefits for close to 30 years. If they started at age 62, when they could get benefits, they delay, it's almost the same thing because they get, those delayed payments get grossed up through various annuity factors that raise their benefits. So a typical couple is now getting benefits for close to 30 years. That's still in the system. We still give more and more years as people live longer. Well, add that to the wage indexing, the system automatically grows faster than the economy, forever.
Yeah.
And that would be assuming you didn't have any issue with respect to the other side of the demographics. I mentioned people living longer. The other side is the fact that people were having fewer children. And the system was largely built as a pay-as-you-go system. Workers pay, retirees get benefits. Those workers become retirees, their children start paying into the system. When the birth rate falls, all of a sudden the number of workers supporting retirees drops. It drops from initially in the system when it was 6 to 1 and 5 to 1. This isn't all the birth rate, but the birth rate has a lot to do with it. It's down to 4 to 1, 3 to 1, and it's going to 2 to 1, and will still drop from there if our current birth rates stay as they are. So that basically raises either hugely the amount of taxes you have to pay to transfer to the elderly, or you might balance it by limiting the growth in the elder benefit. So take all three of those factors, and you have a system that's absorbing more and more of the economy every year without limit.
Yeah. Now, just to be clear for our audience, it's possible if you just go through the math, is it not, that we could tweak the formulas and still allow for real growth.
Oh, definitely.
And still make sure Social Security was solvent, make sure we don't do anything to current beneficiaries. Social Security spending would still grow in a real terms, but we wouldn't be pre-committing to the levels we're doing here, and a lot of it could go toward other priorities, including deficit reduction or spending on other, younger Americans. Is that?
That's right. And let me give you a set of numbers that I do an annual update every year. This is the lifetime benefits and taxes paid by each generation or each cohort as they go along. So, and I'm going to make this statement, particularly to you millennials out there who might happen to listen to this broadcast. So, a typical couple retiring in 2015 got about $1 million in today's dollars in Social Security and Medicare benefits. So I'm going to add Medicare in there. I think it's 2/3 Social Security and 1/3 Medicare. That's the lifetime benefits. That's 20 or 30 years of benefits added up over time. The lifetime cash benefit isn't necessarily that large, but do it over 20 and 30 years, add in Medicare, add in a lot of other things like that, and they get about $1 million. The system is now projected so that the growth in that system is now for millennials promising the typical millennial couple to get $2 million. Now I'm talking about real dollars in today's dollars. Well, as you just said, you could still have real growth in the system. What would happen if we decided, if you millennials decided, I would rather not have $2 million when I retire, but I'd like to have more money to help take care of my family today. I'd like to have bigger child credits, or I'd like to have, maybe you'd like to have a tax cut, whatever. I'd like to have a little more money today. So let my growth and my benefit not go from $1 million to $2 million, but to go to $1.5 million.
Yeah.
So the growth is there. It's just that we're foreordaining where the growth goes. The elderly deserve to be supported. We get richer, we should support the elderly more. But we shouldn't foreordain so much that we cut off and squeeze out everything, almost everything else government does. And if you go back to this Fiscal Democracy Index, if the slide is still showing, what you are not quite getting out of that, you're getting sort of the budget story, the deficit story, but part of the way that we're paying for this decline is with a significant cut in discretionary spending. So we're squeezing out a lot of the programs we would provide to younger and middle-aged people, including, by the way, these wage earners who I think we have neglected quite often, particularly the moderate wage earner.
Right.
We don't have money for programs for them because we're going to just help them when they retire.
Right. And of course, just to go one step further on this, and then we'll turn to Medicare a little bit, but on Social Security, you could do a design that would allow for massive compounding over time. I don't think people really realize how big the numbers get. If you make a small change across tens of millions of people in the future, you can save a lot of money. And so if you just adjusted down maybe just the top bracket in terms of they have a formula for rates of return in Social Security. If you just affected those who were the highest earners a little bit and then compounded that over time, it builds into a very large sum. Is that?
Well, that's correct. Although I'm going to have to put in a warning about what we can do short run versus long run there. But I did a set of numbers. I don't know whether they're still accurate, but with some numbers that Steve Goss, the chief actuary of Social Security, has done. And I looked out in the 75th year of what would happen if we decided we're going to keep the number of years of retirement the same. So as people live longer, no additional years, they still get the same number of years. And it actually solved, in the 75th year, 50% of the current deficit.
Yeah, right.
That one thing, but of course, that's 75 years of compounding. In the first years, it does almost nothing. And the system is now so out of balance, the revenues, the receipts at Social Security are now below and growing significantly below the spending already. They're already so low, it's almost impossible, I think, on the benefit side to get that compounding effect, to have a big effect for 10 or 20 years. So I think we're going to have to turn to revenues. And I think people from left to right realize that if you're going to maintain just the benefits of people who are currently retired, we're probably going to go to general revenues. We're probably going to have to go beyond what's the trust fund financing of that system.
Interesting.
Simply because the benefit compounding slowdown you're talking about takes a while to build into the system.
Can I make an amendment to that? What if we allowed general revenue but on a borrowing basis, and we saved more money later, we paid it back? Is that a doable proposition?
Oh yes, and in fact, I think a lot of people think that's very likely to be what happens.
Yeah.
In some ways, the people that wanted to sustain the current system's benefits, they won the battle.
Right.
We're so close to the day of reckoning that we're not going to cut back on current retirees' benefits.
Yeah.
We're just not.
Procrastinating does reward those who don't want too much
some
reform.
of those.
But there's a day coming sometime when this will have to be addressed. All right, now to Medicare, which is another layer of complexity, right? Which is, it has all of the elements you've already discussed, that there's a changing ratio of those on the program to those paying in. There's the real growth built into a lot of the benefit that's available, but then it's an added layer of complexity because it's an insurance program in our already extremely complex health insurance system. How do you think about compounding and maybe tweaking that program so it delivers the same kind of fiscal return that you can think about in Social Security?
Right. Historically, the Social Security growth was the dominant issue, but you're right. Now the growth in the healthcare spending is actually growing even faster than Social Security, and it's actually probably the major issue in terms of getting this budget under control. But again, I would add Medicaid and Obamacare exchange subsidies and all these other things, and the tax subsidies as well to this whole list. And you've written a lot on this, Jim, so maybe we should have you do.
I want to hear how you fix this.
Do the talking. So the dilemma here is that the system has been built up, with some exceptions, basically has turned the power of appropriations away from Congress to the individual and to the medical suppliers of goods and services. You have this debate where the Supreme Court is saying, well, Congress has turned too much power over to the administration, to the executive branch. Well, in this case, they skipped the executive branch. They've largely turned a great deal of power over to individuals. So, and actually, this was just recently then, I had a choice to go to the doctor. When I go to the doctor, I'm on Medicare, I'm automatically charging somebody else. And that's fine at some level. I mean, it's an insurance system, and the insurance system should do this. But as you know, this creates a very bad set of incentives because at some point, I don't care about the cost. And it's probably less the individual who's the problem here. At some point, the providers don't have to address it either. And so this is a tough issue because if you're going to limit the cost of anything, somebody has to be able to decide how to do it.
Yeah.
And if Congress is going to wants to give us access to whatever health care is out there, and it's not going to say, it probably doesn't want to say, I want to cut this out. Here's a great cure for cancer, but I'm not going to provide it. Then they've got to have a system that puts constraints on the system, and that have to empower somebody. So one way of empowering somebody is you create It's what some people call premium support, some people call vouchers. It's basically what Medicare Advantage does, Part C, or tries to do, is you say, here's a pot of money to the provider. This is what you get to take care of our Medicare recipients or our Medicaid recipients. And now within that budget, you need to provide X number of goods and services. It's not an easy issue, but that puts a constraint on it. The other way you constrain it is you basically, you empower somebody, and I think Congress can sit there line by line and go through it. You empower some agency to control the prices.
Yeah.
And what we actually have now in Medicare, we actually have both systems in place, but not with the power of enforcement, because the traditional Medicare does have some price constraints, and Congress and the president recently passed a few constraints on drugs. Well, actually constraints possibly because they're going to bargain over it.
Yeah.
But you, within that system, you basically just have to empower somebody to say, this is what we're getting. I liken it to where I think long run it would go, because we do live in a free democracy. And this would be probably closer to perhaps the Swiss system or some other one. Mm-hmm. But I'll liken it in the American context to what we do with public education. Here's your public education system. We will pay for it. This is what you get. If you want something else, you're free to go do it outside of the school hours. You're free to not go to the public schools, but this is what we're going to provide. And then every year we debate, well, how much more should we put in public education? And then how much more should we put in Medicare versus everything else? The crucial ingredient is actually getting the debate to take place and not have it take place automatically. Because as you know, the stuff that's growing automatically may not be the most important stuff. For instance, we don't really do well on the preventative care side. So the preventative care is not automatic in many cases, but we can't put money in there because we're already promising to do more for chronic and acute care.
Yeah. Let me go to
I'm sorry, that was a long answer.
No, that's because it's a complicated topic. It's a very interesting, excellent observations on the whole problem. Let's go to another aspect of this, a little bit for the technical crowd out there who's watching, which is related to everything you just discussed and we've been talking about, which is the fact that we have trust funds for Medicare and Social Security, especially for Medicare hospital insurance and Social Security. And they're supposed to place a check on the spending of these programs over time. In other words, Congress gave spending authority, budget authority, via the amounts in the trust funds to spend on Social Security and Medicare. But through a lot of complexity in how our rules are decided, even though both the HI Trust Fund and Medicare's Old Age and Survivors Insurance Trust Fund are both projected to be depleted relatively soon, the way we make these projections shows we assume that they have spending authority at unlimited levels going forward. In other words, there's sort of a mismatch between a technical reading of what the law allows and what we assume is going to happen in our projections, which of course are all very alarming. Trying to fix this is very difficult for a lot of reasons. How do you think about this question? I know it's a baseline question, so to speak, but it has real-world implications.
It has huge implications, and I think the whole system is a mess. And I will blame us as well, even on the outside. So when we, for instance, do a distributional table for some benefit program or some tax program, and Congress operates on what I call the giveaway side, so it's not going to pay for it.
Yeah.
We'll show a table that says, look at all these winners we're creating.
Yeah, right.
And so the losers, the people who have to pay for those deficits down the road, we don't count. And then if we ever decide, well, let's identify who's going to make up and make those payments.
Yeah.
Well, then we count them only as losers. But that, in that legislation, when in fact all legislation creates winners and losers. Everything is paid for. It doesn't mean it's not good. It doesn't mean, for instance, when you put money in your child's education, that it's not a good thing. But it's wrong to say you didn't have to pay for it, or somebody had to pay for it. So this, what you call baseline issues, has got huge problems because, and it's hard for people to understand, but anytime anyone picks up the paper almost and identifies, well, who's the winner, presidential candidate X, Kamala Harris or Donald Trump says they're going to forgive taxes on tips. Well, they're not going to go out there and tell you who's paying for it.
Right.
You know, so it's just a very misleading discussion to begin with. And if it's built into the law, then as I say on the flip side, okay, now let's say we have this tip adjustment, it's in the law permanently, and somebody comes along and says, well, no, I think that's a ridiculous provision because it's discriminating against normal wage earners. They would be accused of attacking and creating these losers.
Right. So, the fact that the trust fund doesn't allow spending beyond its current authority doesn't get reflected in any of the political debate, because if someone comes along and says, well, I just want to make sure we don't overspend what the trust fund says we're not allowed to spend, we're going to change the law so it conforms with what's required already. Yeah, it looks like a massive cut.
Yeah, you're getting into, there's another crucial thing here is if things like demographics, no great emergency came along, and you came along and hit trust fund just going slightly out of balance, then the adjustment, then the trust fund mechanism works. It starts, okay, Congress, you've got to do a benefit cut or a tax increase to get it back into balance. When you got huge imbalances, that mechanism just doesn't work. And as you well know, in Medicare, I'm not so sure we shouldn't actually throw the whole, either decide we're going to do the trust fund balance or not do it. But as you know, most Medicare spending doesn't come out of the trust funds anymore now. So the trust fund itself is running deficits, annual deficits. And most spending is not in the trust fund anyway. It's in Part B. It's the doctors and the equipment and all the other things people buy outside of the hospitals.
Yeah. Right.
So that system is, and then Congress, plays all sorts of games. Well, can we move some spending into the Medicare Part B and then Medicare Part A? It won't look as bad. It's just a mess. I wrote a piece. I don't know if you saw it, but we now finance Medicare as a whole through identifying more than 12 mechanisms.
Yes.
Now I'm counting things like deficits and the fact that we squeeze out other programs as among those 12. But it's sort of like, how could even Congress, I bet if you went from every Congress and said, do you know how many sources of payment there are for Medicare, they'd have no idea.
Right. I'm pretty sure you're right about that one. Look, we can't get through this whole program without turning to one of your other, Gene is like a jack of all trades. He knows a lot about a lot of these issues. And another aspect of your career that we should tap into here is being part of a big effort a long time ago now, but to reform the tax code to make it fair, less complicated, and simpler for Americans to navigate. Here we are on the cusp. 2025 will be a big year for tax policy just because of so many provisions coming to an expiration date. Congress is going to have to deal with this big, complicated question of corporate and individual taxes. Sometime, in the next few years, maybe they won't do it all next year, but there will be some decisions have to be made. We need more revenue probably because of all these fiscal questions we've already been talking about. Plus, it's already complicated. We need to have good growth. What is your advice to how to approach this very complicated set of trade-offs?
I'm at the stage now where I think we can't solve the revenue problem by itself, or the Medicare problem by itself. I think we need some big grand bargain, but by grand bargain, I don't mean the type of bargains we had in 1990 or 1993 where the members got together and they struggled and maybe reduced the deficit by about 1%, and they didn't deal with the long-term issues that are driving the budget. So if we simply try to raise revenues to pay for spending that's growing faster than the economy, we haven't solved the problem that I laid out is to, basically zombies or dead people controlling the budget. And even if you got the system to where it got basically into balance by some projection under current law, under some baseline, well, as soon as Congress met any new emergency, remember we had 3 major emergencies in this century, right? Yeah. We had 9/11, we had COVID, and we had the Great Recession. That's in this course of less than a quarter century, right. And we're going to have more of them. And by the way, Congress did not set up any mechanism to pay for any of them, before or afterwards. And so I think you've got to solve the revenue problem as part of a grand bargain. Within that grand bargain, you're going to do the same thing, I think, with tax subsidies. I think that you have to do with the automatic growth in spending. You've got to cut back the automatic growth. Congress is going to have to vote year after year, or not, at least occasionally. You don't have to appropriate every year, but you could have a system every few years. You decide how much of that particular deduction or credit you really want to extend. Even things that I really like child credits or charitable deduction. I think you've got to do it for anything that's got automatic growth.
Home mortgage.
Well, home mortgage, I would actually, I mean, this is an example of getting it, I should call it the weeds. It's
a huge
it's more
issue.
like the forest, but,
Yeah.
but the home mortgage interest deduction is really an extraordinarily bad subsidy because it basically is encouraging people to borrow.
Yeah, right.
So if you care about home equity and buildup of home equity, I think the thing you want to do is something like a first-time home buyer's credit.
Yeah.
And get rid of the home buyer's credit. But then with the first-time home buyer's credit, it can't be just money you get this year, and then if you sell the house the next day, you get the money back. It actually has to be figured out some way that the money or the benefit is allocated over time, say a long-term loan or something.
Right.
So that's getting into all the forest, the weeds, the trees you've got to get into to deal with the tax system or the system as a whole. Let me mention, I think I may be wrong, but I've had people say I was coordinator and original organizer of the '84 study. This is 40 years ago, that led to the Tax Reform Act of '86. But we had huge trade-offs, created a lot of winners and losers. But we put out a program of such a magnitude and such a different vision for where we were going that both sides of the aisle accepted it. And even though it created a lot of losers, which Congress hates to do usually, we actually succeeded. And I think that's part of what you have to do in a grand bargain project. We have to show the public that if we do these things, we could start really hiring quality teachers, or we can really start dealing with the needs of the working class, who I think have been neglected. We can start, it'll be gradual. We can start doing a lot of other things. That's, I think, how you sell it. You can't just sell it that we're going to eat spinach and cut our deficit.
Yeah.
Because as I say, everything that we're paying for now, we're paying one way or the other.
Right.
A deficit reduction package doesn't create any more losers than a spending package without paying for it creates winners. It creates winners and losers if we're honest about it. And we have to show those winners down the road. We have to show long-term that we're just going to have a much better economy, a much better budget, and a much fairer system. And I think there's ways to show both sides of the aisle we could get there.
Yeah, right. I like to go through the thought experiment with people is to say that imagine if we had these near-term $2 trillion deficits, and we're all, as you were sort of in your opening remarks, this has always been a perennial problem. The near-term pressure on a democracy is to, give a lot on the giveaway side, not so much on the takeaway side. However, if for whatever reason we built into our current laws adjustment provisions that made sure that over time we're going to be basically in balance in 2040 and 2050, and our debt won't be soaring like it is under the current projections. I mean, in some ways, I sort of think that we'd all feel a lot better about where we're going if that was the case, because we know that there's some decision-making still ahead about how to use our resources. Am I gathering, is this on the sort of how you think about it?
That's right. And as I say, the problem is if we do the traditional distributional table, and by the way, we did this tax reform, we adjusted the distributional table to reflect reality, and I won't go through the details. You've got to do the same thing here. You can't just show it as creating a bunch of losers.
Yeah.
Because what you've got is you've built this extra money coming in that may go back just to taxpayers as a tax cut. It may go for, as I say, for things that I would like for children, and who I think we've largely neglected, working class we've largely neglected. But it will not be pre-designated. So you got to figure out some way to show the public that is a benefit that's coming down the road when you do these types of things.
Right. One other interesting aspect of your work in this area related to the last slide we still have up on Democracy Index is, in some ways you hint at it, but in some ways I think you also are somewhat explicit in other places we've written, that we can trace a little bit of our unease, a little bit of our political discomfort that is so evident in so many different ways in our country these days, to some aspect of, we're not allowing our political process enough room to maneuver to make decisions that the voters can feel good about right now because we pre-cooked so much of it into existing spending streams and tax policies. Is this a part of our democracy problem?
Oh, the reason I called this a fiscal democracy index is I think we've taken power out of the public. So what I haven't got into yet is if you think back to what Madison did in the Constitution with the way he set up checks and balances, he made it a little bit harder to try to do something new, particularly something permanently new. You know, you had to get at least the House, yeah, and then the Senate, and then the President to agree to it. And they were even organized different ways. So in some ways they represented different constituencies, or they represent each of us as parts of different constituencies. And so it was like a supermajority that you had to get to do new things. Well, now so much is built in. All the new things are built into the system. Now it takes a supermajority to cut back on a promise made from the past.
Yeah.
And so that's taking democracy away from the people. And I talk to, as you, I talk to a lot of elected officials, and on both sides they're really scared. They say, well, if I give democracy back to the people, they're just going to increase that darn spending because the deficits aren't there. And the other side, the Democrats say, oh my gosh, if I give democracy back to the people, they're just going to cut taxes and our whole system's going to fall apart. Well, you know, quite honestly, we had a lot of problems in the first 150 or beyond years when we didn't have this long-term budget problem. And believe me, both sides found ways to increase spending or cut taxes. Back from when Hamilton won the battle and got the tariffs at first, and then when Jefferson finally got to be president, they cut back on the tariffs, you know, so that's democracy. That's right. Democracy. And I would add to this, I really think that this fiscal democracy issue, this is the main, in many ways, the main function of Congress is to deal with spending and taxes in the budget. And when they're not doing it well, what do they turn to? Well, how about cultural warfare? Hey, Jim, let's have a cultural war where we have very little influence over what's going to happen. But let's have a big cultural war, and that's what we'll fight over, and we'll just skip dealing with our job.
Yeah. Brings us back to a couple of the questions that we received. We're nearing the end of our time with Gene. And this is, I hesitate to even go down this road, but of course there's a lot of interest in, you know, what's going on in the campaign right now, right? I mean, the conversation we're having right now, of course, couldn't be further from sort of the nature of a lot of the discourse that's immediately, and I understand it too, in the electoral process. How do you see, how do we get from here to there? In other words, what is the prospect for merging up our political processes with thinking about the problem more in these kind of terms? It's obviously a credible challenge, may not even happen ever, but what would you say if someone said, how do we get our elected officials to start thinking this way and maybe communicating with the voters this way?
So it's interesting. I think if we actually would have this one great big one-time fix.
How do we get to the fix, though? How do we get
let me just talk about what happens when you get there. Is in the old world, members of Congress or people who are running for office always wanted to tell us what they were going to do for us. You know, that's a human instinct. We want to be on the optimistic side. What new things are we really going to be able to do? What can I do for you?
Some of which very legitimate, yeah.
And they're always going to want to do that. And we're seeing in this campaign, the complication of this campaign is they can't pay for it. So actually, in some cases, they have these little tiddlywink ideas that are bad ideas to begin with, but they appear to give a little bit to some constituencies. But we've had that in State of the Union addresses too, right? Where the State of the Union says, oh, here's the 70 things we're going to do. And well, maybe we'll have the richer immigrants or some group that's not going to vote for me anyway pay for it, you know. So if you get in that type of world, elected officials can compete over what they're going to do with the additional revenues.
With growth.
And if you have problem one, the traditional problem, profit year after year, all you need is a little bit of a stalemate. In some ways, that's what happened in the Clinton administration, when we got a lot of deficit reduction. It wasn't just the 93 agreement, the 90 agreement that was legislated. It's like for the next 7 or 8 years, we had no major enactment, and we had a lot of good things happening. But that stalemate meant the revenues were starting to grow, And the automatic spending, so go back here to the 90s, you still got something left in the budget, sort of takes over. So you don't need the Congress to have to renege on something. They just need to slow down their problem one, the non-long-term issue, the short-term being profitable year after year. So that's what you got to get to. To get there, as I say it, I don't have an easy answer, but I do have an answer, which is this real need for these types of grand bargains. And let me mention that the Peterson Foundation tried to get at that recently by having a series of 7 or 8 think tanks. You were one of them, that came up with their what was their version of a grand bargain. And then the Center for Collaborative Democracy also had a different version of this. They were less identifying programs. They're trying to think really big things like, what do we do to solve the energy problem, a little less than the numbers. So I think there's some thinking along those lines, and I'll make a pitch to anybody out there. I think the funders here are way behind the 8 ball. I can't think of any funder out there who really puts much money into thinking about this. I don't know that, in some ways maybe people in the traditional public, there's so much money that goes to advocating for particular groups and particular provisions. It's really hard to have a discussion of trade-offs. If I really want to get more spending on children, I may not be willing to actually, if I'm a foundation, I may not want to put money into, and who are you going to have pay for this?
Right.
Because that complicates the issue. But at this point in time, at this point in our history, this is just unavoidable. This is an unavoidable problem that has to be addressed, whether it's what you mentioned, the trust fund, Social Security trust fund running out of money, Medicare trust fund running out of money, interest costs, I could get into that a little bit too. Interest costs for the first time in 40 years, the rate of interest is going up at the same time the amount of debt is going up, and that's starting to really compound in ways that we haven't seen for quite a while because interest rates kept falling. So all this is hitting the fan.
Yeah.
And there is an answer. And the answer, as I say, is an optimistic one. We're actually trying to free up resources to do all those things we haven't done, to deal with all those groups like children, the working class, and I would include, by the way, the asset development for a lot of disadvantaged groups like Black people whose private wealth has not increased at all relative to white people's wealth over the last 30 or 40 years.
Yes.
So we could start tackling those issues. We can't tackle them until we decide we have to have some fiscal democracy and fiscal freedom to do it.
That's going to have to be our last word, and it was a very good last word. Thank you, Gene. We're out of time. Thank you to the audience who is watching us today. We're going to have to do this as a part 1 because there's obviously a lot more to be said. So
I'd be honored. I'm a great fan of your work as too, Jim.
Yeah, thank you, Gene.
Next time I'll ask you the questions.
Yeah, very good. Thanks very much to Eugene Steuerle for joining us today. That concludes our program.